Sorry about the inconvenience. There is a disturbance in the network. Now I start only in the Facebook Live. So, investigation intravenous urography. Intravenous urography to assess the anatomy, physiology, and pathology of the urinary tracts. Look the picture. There is the kidney on the right side is normal in appearance. Pelvic elevation system, ureter is normal in appearance, well delineated. On the left side, the ureter is not visualized. The pelvic elevation system is widely dilated, which indicates the patient having left-sided hydronephrotic change. So there is obstruction into the left kidney. So this eye view can delineate what is the function of the renal system is. Next investigation is CT imaging. That CT images are more accurate than eye view, and 3D reconstruction imaging is possible to do with the CT urography. In that CT urography needs the IV contrast agent must be needed. So the treatment, the treatments are conservative treatment. That means expectant treatment. Whenever the stone calculi is less than 0.5 centimeter are likely to pass spontaneously unless they are impacted. Drink plenty of water and do exercise. Check X-ray periodically. Treatment. Preoperative treatment. If urinary infection is present, appropriate antibiotic treatment is started, continued during and after surgery as necessary. Operative treatment. Minimally invasive techniques. ESWL, that means extracorporeal shockwave lithotripsy, PCNL, percutaneous nephrolithotomy. A newer minimal invasive technique is available nowadays, RIRS with laser lithotripsy. That means retrograde intrarenal surgery. So others are open surgery performed via loin or lumbar approach. Pyelolithotomy for stones in the renal pelvis. The name of the operation is called pyelolithotomy. Whenever the stone is extended up the calyces connected with the pelvis stone, then the name of the operation is extended pyelolithotomy. If stone has extended into the calyces from the pelvis in case of staghorn calculus. Nephrolithotomy, if stone is present only in the calyces. So in that case, you open the kidney by incising the incision over the nephron, go in and remove the stone, which is called the nephrolithotomy. So, treatment of bilateral renal stones. Usually the kidneys with better function is treated fast. The operation on the contralateral side being deferred for 2 to 3 months. Exceptions are if either one kidney is more painful, suggesting an obstruction, or there is pyonephrosis in one kidney. This must be drained by percutaneous nephrostomy. So, this is about extracorporeal shockwave lithotripsy. It is done for stone size is usually less than 2.5 centimeter in size. The crystalline stone are disintegrated into fragments under the impact of shock waves of sufficient energy. When ESWL is successful, the stone fragments have to be passed down in the ureter. Ureteric colic is common after ESWL, and the patient must be given adequate analgesia. If the stone is large, the fragments of stone may become impacted in the ureter, causing obstruction. To avoid this, a self-retaining stand should be placed in the ureter so that the kidney can drain while the pieces of stones passed. So this is the video of ESWL, extracorporeal shockwave lithotripsy. Look at the picture.
External shock waves are directed to the location of the stones in your body and which break the stones into tiny pieces. When you urinate, these pieces are then discharged from the body along with the urine. This animation shows the removal of stones in the kidney. There is usually no need for general anesthesia, but pain medication is administered for comfort during the procedure. You are placed on an operating table with your flank positioned towards
So shockwave is introduced from the back directly over the stones by imaging with the C-arm guided. The stone is identified and locate over the stone directly hit the shockwave lithotripsy.
stone absorbs the energy of the shock waves and breaks into pieces as small as grains of
So these are passing down. So this is about ESWL. So what about the percutaneous nephrolithotomy? Nowadays it is more popular in our country also. It is very popular and very sophisticated surgery, easily can done if the surgeon is expert enough. It is done to removal of large stones more than 2.5 centimeter. The procedure is performed under general anesthesia. A hollow needle is inserted into the kidney under imaging guidance, ultrasound or CRM guidance. A guide wire is then inserted through the needle. The tract is expanded into the kidney by inserting the dilators over guide wire. A nephroscope is inserted into the kidney via the tract and the stone is broken up and extracted. When the operation is finished, a nephrostomy tube is left to drain the kidney system. This decompresses the kidney and allows repeated access to the system if stone particles remain. Sometimes PCNL is combined with ESWL in the treatment of complex calculus. So this video is about the percutaneous nephrolithotomy. Look the
goal of this procedure is to
video. So stone lies in the renal pelvis.
This animation shows
The access is made from behind because from behind the kidney is directly attached to the posterior wall. So there is no chance of injury to the other structures if you do the PCNL with proper X-ray guidance or ultrasound guidance done. So put a ureteric catheter through the ureter, go up to the pelvis. It helps whenever do the PCNL from the exterior they make some water pressure from outside through the ureteric catheter, so the pelvis and calyces are more distended and easily can puncture and enters the calyces. For that reason, that ureteric catheter pushed there. So the percutaneous needle is inserted through any calyx, any of the one of the calyx. Then go inside. There is a guide wire is placed there. Remove the needle. Over the guide wire, the dilator sheath are applied. Gradually increase the diameter of the sheath. So whenever the desired diameter is achieved, then the guide wire is removed. Through the sheath, introduce the nephroscope. So over the nephroscope, then the small stone can pick it up and remove it out. In a larger number of stones are broken down by either this is laser lithotripsy or by a pneumatic lithotripsy. Whatever is available, you can do it by broken the stone piecemeal and remove it out through the nephroscope. And after that, put a tube through the opening and another stent given inside the ureter. So rest of the stones and debris can come out through the ureter to the bladder whenever there is a stent put inside the ureter.
double the J stent may be placed to ensure that swelling doesn't block the drainage of the urine.
So this is called percutaneous nephrolithotomy. Whatever the size, it can possibly do it. Sometimes needed to 2 or 3 puncture. Other calyces stones can be removed by another puncture. Some same sitting or subsequent sitting. Or sometimes they add with ESWL associated with PCNL. So stent remains there. So this is about RIRS, retrograde intrarenal surgery. Nowadays it's very sophisticated surgery which is also available in our country. Through the urethra, go to the bladder, go to the ureter and go inside the pelvis. It is a flexible endoscope by which you can easily evaluate the all calyces by move the flexible endoscope. Which calyces the stone is like there, over there they apply the laser. So that laser can broken the stone in a small dust manner and subsequently it can remove the dormia or it can spontaneously expel out through the ureter without any external opening, without any incision. It can possible in case of renal surgery. This is the latest sophisticated surgery one. So the name of the surgery is So treatment, open surgery for renal stones. The first picture is the pylolithotomy. Whenever they open the pelvis, remove the stone, it is called the pylolithotomy. Whenever the stone is extended up the calyces, needed to extend the incision towards the calyces, which is called the extended pylolithotomy. And whenever the needed to incise the kidney parenchyma, then the name of it is called nephrolithotomy. So this is about the renal stone. So do you have any question? You can write in the messenger or in the Facebook page or any other means. Whatever you need, you can ask subsequently. So thank you everybody for patience here.